right, here we go. Another episode of Canada on the Rocks. I am your host, Fadi Kuder, local realtor with Sutton Group Ottawa. And today I am joined with someone that I met recently, Dr. Behn Banihashemi, founder and CEO of Cardiac Longevity Clinic. I'm glad that you brought this up because I was going to ask you between the difference, because we see a lot of gurus, again, health gurus, workout gurus, and so many. When it comes to the way we exercise, everyone has their sort of, what you should do. What are your thoughts on that? And what do you think is a good practice?
It's interesting that you asked that question because I struggle with that a lot. Out of everything that we practice in our clinic, coming up with a comprehensive exercise program is probably the biggest challenge. And the reason is exactly what you're saying, because there's so much conflicting evidence out there. And the other reason is because exercise science is just not as rigorously studied as medical science. There are no randomized clinical trials, which is how we like to do things in medicine and come up with evidence. Most of the evidence is anecdotal, expert opinion, never been really rigorously studied. So that's why there's so much conflict in data out there. But when you look at the data as a whole and kind of look at everything, which I've spent a lot of time doing, I would say a comprehensive exercise program needs to have four main components. So number one is your aerobic capacity. So you need to do some form of what we call cardio. Mm-hmm. Inevitably, you have to do that. Now, if you do that in the context of interval training, and I know you like CrossFit, so if you do it in the context of something like CrossFit, for example, that can provide some of that cardio for you at the same time you're doing strength training. But you need to have some sort of an aerobic exercise where you get your heart rate up and maintain your heart rate at an elevated level for at least 200 minutes a week. Lots of good evidence that suggests that is a huge effective part of an exercise program to reduce your risk of death, reduce your risk of heart attack and stroke. So no brainer there. Number two is I think you need to do some sort of a VO2 max training. So when I talk about aerobic exercise, actually is what I'm referring to is what we call zone 2 training. So when you get your heart rate to about 70 to 80% of the maximum predicted heart rate and then maintain it there for a prolonged period of time. So zone 2 training should be the foundation of your aerobic exercise. Is your heart rate is up, stays there for a long time. It is not massively up. It's not at 90% and 100% of your maximum heart rate. It's about 70 to 80%.
Yeah.
So that's kind of a zone 2 training.
What is that for a healthy individual, for folks that are watching? What does that number look like if I'm looking at my Apple Watch, for example?
Yeah, so I think a good way of tracking that actually is instead of tracking your heart rate, to track something that we call perceived level of exertion. So in order to do that, basically think of you being able to still talk in full sentences, but not being comfortable talking in full sentences. That is zone 2. So if you're comfortably talking, let's say you're running on a treadmill and you're comfortably talking, that's zone 1. If you're short of breath to a point that you cannot talk in full sentences, that's already zone 3. So you're already going into anaerobic exercise. So to be aerobic at zone 2, you need to be able to talk in full sentences, but not comfortable, not wanting to talk in full sentences. So that's a zone 2 training.
So you're talking, but you're begrudgingly talking, not necessarily 100%, but you're still able to form a full sentence. You're still able to think it too.
Exactly.
There's a lot of advice. There's a lot of good advice. There's a lot of bad advice out there. How do we discern between what's good and what's bad? And what can we do for example, to use your expertise or someone like yourself to help us out with that?
Yeah, so that's a great question. I think, there are a couple of gurus out there that I kind of commonly listen to that I think have the credibility in the field based on the credibility of the evidence that they provide. So I would say Peter Attia. I don't know if you've heard of him or not.
No.
So Peter Attia is definitely a great person to kind of listen to. Huberman, Andrew Huberman is another one that is really great. So those two are, I would say, out of all the people that I listen to, are probably the ones that are the most credible, that actually provide you with the evidence rather than just telling the expert opinion. But ultimately, if somebody wants to get the expert advice and actual personalized recommendation for them, then they should probably go to a longevity clinic similar to what we've kind of established here in Ottawa.
So what would that look like? Like when I'm going to a longevity clinic, is that like a combination of a bunch of practitioners, or what does that look like?
Yeah, so the way we do it here in Ottawa is that, so I basically work with a nurse practitioner, and then I have a group of diagnostic technicians that help me with it. So the way we do it is we do a full history and physical assessment, first of all, on the patient to kind of get a pretty good idea of your current medical status. We do a full panel of blood work looking at your metabolic health, as well as some of the genetic markers that can affect your cardiovascular health, as well as things like your cholesterol profile, all of your electrolytes, whether you have any nutrient deficiencies. We look at all of that panel. Then we do something called DEXA scan, which is a way to look at your body composition, which is a massive determinant of your metabolic health. So we look at your muscle mass, how much visceral fat you have, which is a huge determinant of your cardiovascular health and your metabolic health. And then we do a full cardiovascular workup that includes a cardiac ultrasound to make sure you don't have any structural heart problem. We do a stress test to make sure there's no blockage in the arteries of your heart. We do a carotid ultrasound to make sure you're not at a risk of stroke. And then we have a strength coach that goes through all the exercise metrics that we talked about to come up with a comprehensive exercise program for you. We have a dietitian to look at your nutrition plan and optimize that. We do a home sleep study on you, and then you get that analyzed by a sleep specialist to make sure that your sleep metrics are within the range that we recommend. And if not, then we'll help you achieve that. And then we do a mental health screening on you as well to see how you cope with stress, whether you have any other mental illnesses that are undiagnosed. And if that's the case, then we'll connect you to one of our network of psychologists and counselors to address that. So basically, it's a full cardiovascular and metabolic workup plus those lifestyle pieces, assessment and optimization.
And is it fair to say, like, without those additional life pieces, like you said, the lifestyle, is it possible without? Can you still, accomplish a good cardiovascular health without any of these?
Definitely not. I mean, that's why they're an integral part of our program. I think the lifestyle should be number one. And I think most people would agree with that. Instead of taking a medication that has lots of side effects for you, every medication you take, by the way, is not just upside. I'm sure everybody knows that, but there's always downsides to taking any pharmaceuticals. They have side effects, they have complications, short-term and long-term. Yeah. So if I can prescribe you a lifestyle strategy, a lifestyle prescription instead of a pharmaceutical prescription, how wonderful would that be? Because it has no downside. You're only getting benefits. In most cases, the benefit is more than the benefit you get from pharmaceutical therapy. Mm-hmm. And it has no downside, and it makes you feel better. Drugs usually don't make you feel better, whereas lifestyle interventions do.
They're really more of a mask than anything. It's like, I hate the noises, I'm just going to close the window, but the noises are still there.
Exactly.
Doesn't mean that those noises are gone. It just means that they shifted. I just don't hear them as well. One thing that I wanted to ask you, we hear this quite often when it comes to heart health, when it comes to diet, when it comes to weight, all of that. Is there an age where you're like, okay, but like you can't reverse this anymore?
No, so the answer is, as you get older, you accumulate reversible and irreversible changes. So the older you get, you have more of irreversible stuff and less of the reversible stuff. But almost at any age, there's still a component that's reversible. It's just that as you get older, the irreversible piece just gets larger and larger. So there is less impact we can make the older you are. So it's much, much better to intervene, I kind of always say my ideal clients are between 40 and 60 because most of them still haven't developed massive amount of irreversible damage in their body. Mm-hmm. So we're still able to effectively improve their longevity significantly. Now, it could be a lot of 65, 70-year-olds that are also very healthy and I can still optimize. But as you get kind of older, it becomes more and more difficult. But certainly, especially with something like exercise, almost at any age, if you start exercising, you're going to see a benefit. Or something like sleep, almost at any age, if you improve your sleep, you're going to see an impact.
Mm-hmm. The one thing that we always talk about when it comes to, longevity and like long-term and all of that, life is painful. Mm-hmm. Regardless of which way we look at it, there's always pain in life. There's always choices to be made and all of that. Someone once had said to me is like, you just pick your pain. You know what I mean? Like your pain could be a workout or your pain could be in the hospital. It's really your choice.
Yeah. I like
what are your thoughts on that?
Yeah. I like that's a very good way of looking at it. That's exactly it, And it's funny that you say that because sometimes my clients come in, somebody who's had 3 heart attacks and they're still smoking. Mm-hmm. And they tell me, they're like, Doc, I don't care if I die early. You know, I enjoy my smoke, and if I don't care if I die early. But I always tell them, you know, it's not like smoking is just gonna kill you and it's gonna make you like, you know, you're not gonna suddenly die. What's gonna happen is, in most cases, you're gonna have all these complications of smoking. You're gonna have all this pain before you die.
Yeah.
Whether it's lung cancer, whether it's COPD, you can't breathe properly, you can't enjoy things that you normally enjoy. So it's exactly what you're saying. You either go through the pain of quitting smoking now, or later on, you're going to go through all this pain for many years of developing lung disease or cardiovascular disease or stroke.
Yeah. At least I feel this way. Like if you end up choosing the pain, you choose the pain that's a little bit more, I don't want to say comforting because it's not. It's just a little bit more what you want.
Exactly.
You know what I mean? Like, I hate exercises, but I still show up 5 days a week to the gym. I enjoy that concept. I enjoy the fact that I get to talk to friends and like socialize and all of that. There's still pain in it. There's a lot of pain in it. You know, like a 22 minutes of cardiovascular going at like 80% is a lot of pain.
Mm-hmm.
But I'd rather that than, you know, waking up one day and I'm just like dropping dead of a heart attack. What I really enjoy when you talked about that decade is how we can shorten that decade. You know, instead of having it to be a long decade of like you suffering, going back to that same pain, which pain you want to choose, I'd rather, you know, that sort of intermittent pain every now and then versus that long, you know, 10 years of slowly not being able to go up the stairs and like, you know, begrudging to go to the doctors and this and that. Like, I think there's a lot to be said about that.
100%. I agree with you.
If we were to leave the audience with like a piece of advice, you know, 4 or 5 things that they could do to help them be where they're supposed to be or where they want to be, what would that be?
So I think number one, if you're not exercising regularly, you got to start exercising regularly. You know, this is actually pretty mind-blowing data. 90 minutes of just movement a week. So it doesn't even have to be something hardcore like CrossFit. It could be something like just going for a walk. So people who do 90 minutes of regular exercise a week versus people who do nothing, they have twice the sedentary ones have twice the mortality of people who move just 90 minutes a week. That's like nothing. That's less than 15 minutes a day of movement. So that's number one, is start moving. Number two is pay attention to your sleep. If you're not sleeping properly, you're losing out on a lot in life and your productivity and your longevity. Number three is make sure that your weight is overall relatively optimal. We don't have to go into major details of that, but if you have a lot of central obesity and your waist circumference is too large and you kind of know intuitively what that could be, effectively trying to reduce that is going to massively improve your metabolic health. Number four is ensure that every year or 2 or 3, at least on a regular basis, go and see a doctor. No matter how old you are, don't put this off because you can have, and I see this every day, people who think they're healthy and they come in and they have a million problems. It could be a genetic issue that they never address. It could be that their blood pressure was so high, but they don't feel the high blood pressure and it's already caused a lot of damage. So regular health checkups. And the last thing I would say, especially in our Western world, is alcohol. It's a very easy way to massively improve your longevity, reduce your risk of cancer, improve your sleep quality and how you feel. Just cut back on your alcohol. Make sure that you're drinking less than 5 drinks a week and ideally not more than 2 drinks in one sitting.
No, that's amazing because, well, especially when it comes to alcohol and the sleep and all of that, like cutting back on alcohol, I feel like when you have a bad night, your next morning is completely messed up. Your whole week is messed up people that go out on the weekend and all of that, like you're now pulling that whole weekend warrior, but then Monday comes and you're just repeating the cycle over and over and over again. For folks that are watching, like to go and visit someone like yourself, is that more of a referral or is that something that they could just potentially do, call the clinic? How does that work?
Yeah, so they can visit our website at cardiaclongevityclinic.com and they easily can fill out a very short form with their contact information and we'll get in touch with them. They don't need a referral from their family physicians. Family physicians can send us a referral and we'll be happy to see those patients, but patients don't need referral. They just need to get in touch with us. Our email address is also cardiaclongevityclinic@gmail.com. It's on our website. or they can give us a call through our phone number, and within 24 hours, we'll get back to them and kind of.
And when you're getting into that consultation, we've talked about, obviously you have the different individuals that are involved, like the dietitians, the practitioner, nurse practitioner, all of that stuff. For someone that's never done this before, what should they expect?
Yeah, so on their first visit, usually what we do is we bring them in, we do a full history and physical, we get their blood work on the first visit, and we usually do a stress test on that same visit. And we also arrange for them to have their sleep test. The sleep test is a home sleep study, so you take it home with you. So all of that is done within one appointment. Then they have all of their imaging tests on a second appointment. And overall, they basically have 4 appointments in a span of about 4 weeks, where they get everything done, and their final appointment is with me, and we basically sit down and go through all the results and put it all together for them with a plan.
And as far as I don't want to get into too much details on this, but like just from the folks that are watching, is this sort of something that's covered? Is it something that, their extra insurance could cover? What does that look like?
Yeah, so it's a kind of a hybrid model. So some of the services, particularly the diagnostic services, would be covered by OHIP to some extent if the patients have appropriate indications for the testing.
Family history, anything like that?
Family history, or if my nurse practitioner finds issues on the examination, and their overall level of risk, because we give them a risk score. And based on the risk score, if the risk score is high enough, OHIP covers some of these tests. Some of the tests are also covered by private insurance, so things like dietitian, the sleep assessment. So federal government workers with their government plans will have the dietitian and the sleep assessment covered, for example. A lot of the private insurances actually cover the entire cost of the package. So if you have a health spending account, the HSA accounts that a lot of people do, that would cover the entire cost of the appointment. And then, whatever is less then would be out of pocket.
It's fantastic. I should have asked you this question probably at the beginning, but what got you into this?
Yeah, so it is all basically my passion for wellness and the frustration with going through the system and see how we don't have an effective solution for this within our public healthcare system. Unfortunately, we put so much emphasis on treatment, as you said, Band-Aid solutions for things, but without actually addressing the underlying cause. And it's so unfortunate that our spending in healthcare is not going more into preventive care. We spend so little and we give it so little attention. So the whole idea of this is seeing the impact of it on a day-to-day in my own cardiology practice was how can we come up with a structure, with a program where we can help clients prevent disease before it happens rather than being reactive. So more of a proactive, personalized, type of care. Because the other part is personalized. What works for you doesn't work for me and vice versa. So you really need to be personalized rather than a cookie cutter solution for everybody. So the idea was really to come up with something that is proactive, that is personalized, that you can customize to every client and really kind of address their needs on an individual basis.
And a lot of folks, when they hear the word customized, the first thing that comes to mind, it's expensive.
Mm-hmm.
Your health is like, you cannot put a price on how healthy you feel.
Exactly.
You cannot put a price on, the last 10, 15 years of you enjoying your life. You know what I mean? Like, I don't think anyone can do that. With that, I want to leave on a high note. Really appreciate it. Thank you so much for making the time.
Thanks for having me.
And sharing all those thoughts. And hopefully for someone out there that's watching, if you can get a little bit of good nuggets out of this, there's so much to unpack. Again, folks that you're watching, thank you so much for watching. And if you like what you see, please don't forget to hit the like button. Very important that, click on that subscribe so you can get alerts for any new episodes that we come out and learn about businesses that we have in the city. Take care of yourself and be able to kind of use all those services that we have, all those businesses that we have in this lovely city that we have, Ottawa. Again, Ben, thank you so much for coming and looking forward to it.
Thanks for having me, and thanks for everything that you're doing for the community. We really appreciate it.
Thank you so much.